Bell's palsy. Idiopathic Bell's palsy is an acute peripheral facial paralysis of the infratemporal portion of the seventh cranial nerve, facial nerve, unilaterally. It is typically a self-limiting process that usually improves in 4 to 6 months. Pathophysiology and etiology. Cause is unknown. Possible etiologies include sensory ganglionitis of the CNS with secondary muscle palsy caused by inflammation, vascular ischemia, and autoimmune demyelination. Most patients experience a viral prodrome, example upper respiratory infection 1 to 3 weeks before onset of symptoms. Recurrence in patients with history of Bell's palsy or diabetes, although incidence of recurrence is less than 10%. Generally self-limiting. Clinical manifestations. Paralysis of ipsilateral side of face from vertex of scalp to chin. Facial muscles weak throughout forehead, cheek and chin can affect speech, distort face. Involvement of all branches of facial nerve, facial weakness, diminished taste from anterior 2/3 of the tongue, decreased blink reflex, decreased lacrimation, inability to close eye, painful eye sensations, photophobia. Hyperacusis on the affected side. Distorted body image due to change in facial appearance. Diagnostic evaluation. History to determine sequelae of onset. Physical examination for evaluation of seventh cranial nerve function and corneal sensation. Exclusion of lesions that mimic Bell's palsy, such as tumor, infection, trauma, or stroke. Electrophysiologic testing, specifically action potentials of EMGs and NCV to evaluate nerve function. Management. Corticosteroid therapy initiated early to decrease inflammation. Example, prednisone 1 mg per kg body weight per day for 10 to 14 days, followed by a tapering dose. Eye care to maintain lubrication and moisture if unable to close, may need to be patched during sleep. Physical therapy, electrical stimulation to maintain muscle tone. Biofeedback, controversial. Surgery to anastomose facial nerve to other cranial nerve. Controversial due to natural history. Surgical closure of eyelid to protect cornea. Tarsorrhaphy. 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 Non-steroidal anti-inflammatory drugs to relieve pain. Complications: corneal ulceration, impairment of vision, body image disturbance related to facial nerve paralysis. Keratitis, inflammation of the cornea, ulceration and vision loss are major threats to the patient with the Bell's palsy. Protect the cornea if eye does not close. Nursing assessment. Test motor components of facial nerve by assessing patient's smile, ability to whistle, purse lips, wrinkled forehead and close eyes. Observe for facial asymmetry. Observe patient's ability to handle secretions, food, fluids and observe for drooling. Assess patient's ability to blink and speak clearly. Assess effect of altered appearance on body image. Nursing diagnosis: impaired tissue integrity related to loss of protective eye closure, pain related to physiologic alterations of disorder, body image disturbance related to facial nerve paralysis. Interventions, nursing interventions: protecting corneal integrity, administer or teach the patient how to administer artificial tears and ophthalmic ointment as prescribed. Patch eye to keep shut at night as directed. Inspect eye for redness or discharge. Advise patient to report eye pain immediately. Relieving pain: Administer or teach patient to administer corticosteroids to reduce inflammation and non-narcotic analgesics to relieve pain. Teach patient to apply moist heat to face. Perform to or teach patient to perform facial massage to alleviate feelings of stiffness. Enhancing body image. Encourage patient to express feelings related to body image disturbance. Assist patient to use mirror as means to obtain feedback about actual versus perceived appearance and identify factors that impede or enhance. Patient education and health maintenance. Instruct the patient to wear wrap-around sunglasses to decrease normal evaporation from the eye from sun and wind, to avoid eye irritants and to increase environmental humidity. Instruct the patient in use of ophthalmic drops and ointment, proper methods of lid closure and patching of the eye. Demonstrate facial exercises. Example: raise eyebrows, squeeze eyes shut, purse lips, and stress their importance to prevent muscle atrophy. Outcome-based evaluation: cornea without redness, pain or discharge. Patient reports adequate pain control. Patient verbalizes adjustment to body image disturbances. Thank you.